Hi, Lori. This is Dr. Davis. I am reviewing videos, and I just saw yours, and just like all the other ones so far, you guys are doing a great job. And I wanted to address two things. One, Danielle brought up in her video about the use of touch, and I want to address that a little bit because, um, touch can be something that is very sensitive, as you discussed in your video, saying, I don't know if I would have touched, your clients at your previous place of employment, and you have to be careful with that. Touch and counseling is really a case-by-case basis. Typically, we would say not to touch a client, of course, in the beginning of a session, in the beginning of the relationship. And even as you go along, you have to determine what type of client you have, if it is going to be an appropriate way of communicating. A client, of course, who has suffered trauma, that would be something you have to think about if you want to, to reach out and touch them. I mean, you may be compelled to touch them because of the story that they're telling you, and you want to comfort them. But there are many other ways to comfort a client besides touching. I'm not saying that I don't condone it, but it is something you have to really think about, and it really needs to be strategic, because we as counselors have to really take care on how we interact with our client. They're not our friend, they're not our buddies, they're not our family members where we can just take them into a hug when we want to. Sometimes we want to do that because we really, feel their pain because of our empathy. And counselors typically have, and they should have, natural empathy working with clients so they can really understand where that client is coming from, even if they haven't experienced it themselves. But the use of touch, it's a sticky subject, and it's not a right or wrong answer. It just needs to be used with caution, strategically, as well as with the client's permission. I certainly would ask permission before touching a client. Hey, do you? I don't know. There's lots of ways you could do it, but you can ask just outright. Would you like a hug, or is it okay if I pat your hand in comfort? Depending on your relationship with that client, it may just be natural, but then again, it may not. So please be careful, when you start interacting with your clients on touch. There's even therapies that are all about touch, but the majority of them, you have to have that boundary to keep the professional relationship intact.